A stroke is a medical emergency. It occurs when blood flow to part of the brain is interrupted. This can cause brain cells to die. Quick treatment is crucial. The faster you get help, the better the chances of recovery. Strokes can happen to anyone. They are more common in older adults. However, younger people can have strokes too. Knowing the signs can save lives. There are different types of strokes. Each has its own cause and symptoms. Understanding these differences is important. It helps in recognizing and treating the condition promptly. Strokes are a leading cause of disability. They can affect speech, movement, and memory. Early intervention is key to reducing the impact. This video will explore the causes and signs of stroke. It will also offer tips for prevention. Ischemic stroke is the most common type. It occurs when a blood clot blocks a vessel in the brain. This blockage stops blood and oxygen from reaching brain tissue. Without oxygen, brain cells begin to die. There are two main types of ischemic strokes. The first is thrombotic stroke. This happens when a clot forms in one of the arteries supplying blood to the brain. The second is embolic stroke. Here, a clot forms elsewhere in the body and travels to the brain. Risk factors for ischemic stroke include high blood pressure, high cholesterol, and smoking. People with these conditions are at a higher risk. Managing these risk factors can reduce the chances of having a stroke. Recognizing the signs of an ischemic stroke is vital. Sudden weakness or numbness in the face, arm, or leg, especially on one side of the body, is a common symptom. Other signs include confusion, trouble speaking, and vision problems. Hemorrhagic stroke is less common but more severe. It occurs when a blood vessel in the brain bursts. This causes bleeding in or around the brain. The bleeding increases pressure on brain cells, causing damage. There are two main types of hemorrhagic stroke. The first is intracerebral hemorrhage. This happens when an artery in the brain bursts, flooding the surrounding tissue with blood. The second is subarachnoid hemorrhage. This occurs when there is bleeding in the area between the brain and the thin tissues covering it. High blood pressure is a major risk factor for hemorrhagic stroke. Other risks include head injury, aneurysms, and arteriovenous malformations, AVMs. Controlling blood pressure and avoiding head injuries can help reduce the risk. Symptoms of hemorrhagic stroke can be sudden and severe. They include a sudden severe headache, nausea, vomiting, and loss of consciousness. Immediate medical attention is crucial to reduce brain damage and improve recovery chances. A transient ischemic attack, TIA, is often called a mini-stroke. It is a short period of symptoms similar to those of a stroke. These symptoms last only a few minutes to hours and do not cause permanent damage. However, a TIA is a warning sign of a future stroke. TIA occurs when a temporary clot or blockage happens in the brain. The symptoms are the same as a stroke but are temporary. Common symptoms include sudden numbness, weakness, confusion, and trouble speaking or understanding. Risk factors for TIA are similar to those for ischemic stroke. These include high blood pressure, diabetes, high cholesterol, and smoking. Managing these conditions can lower the risk of a TIA and future strokes. Recognizing a TIA is important because it is a warning. If you experience symptoms of a TIA, seek medical help immediately. Early treatment can prevent a future stroke and save lives. Section 5. Medical conditions and stroke risk. Certain medical conditions increase the risk of stroke. High blood pressure is the most significant risk factor. It damages arteries, making them more likely to clog or burst. Managing blood pressure through medication and lifestyle changes is crucial. Diabetes is another risk factor. High blood sugar levels can damage blood vessels. This increases the risk of clots forming. Controlling blood sugar levels can help reduce the risk of stroke. Heart disease also increases stroke risk. Conditions like atrial fibrillation cause irregular heartbeats. These can lead to blood clots that travel to the brain. Treating heart conditions can lower stroke risk. Lastly, high cholesterol levels can lead to stroke. Cholesterol can build up in arteries, forming plaques. These plaques can block blood flow or break off and cause a stroke. Managing cholesterol through diet, exercise, and medication is important. Section 6. Lifestyle factors contributing to stroke. Lifestyle choices play a significant role in stroke risk. Smoking is a major risk factor. It damages blood vessels and increases the likelihood of clots. Quitting smoking can drastically reduce stroke risk. Obesity is another risk factor. Excess weight increases the chances of high blood pressure, diabetes, and heart disease. Maintaining a healthy weight through diet and exercise can lower stroke risk. Physical inactivity also contributes to stroke risk. Regular physical activity helps control weight, blood pressure, and cholesterol levels. Aim for at least 30 minutes of moderate exercise most days. Lastly, excessive alcohol consumption can increase stroke risk. Drinking too much alcohol raises blood pressure and can lead to heart disease. Limiting alcohol intake to moderate levels can help reduce stroke risk. Section 7. Family history, age, and gender. Family history can influence stroke risk. If a close relative has had a stroke, your risk is higher. This may be due to shared genetics or lifestyle habits. Knowing your family history can help you and your doctor take preventive measures. Age is another factor. The risk of stroke increases with age. Most strokes occur in people over the age of 65. However, younger people can have strokes too. Being aware of your risk can help you take steps to lower it. Gender also plays a role in stroke risk. Men are more likely to have a stroke at a younger age. However, women are more likely to die from a stroke. Hormonal changes, such as those during pregnancy or menopause, can increase stroke risk in women. Understanding these factors can help you and your healthcare provider develop a plan to reduce your risk. Regular checkups and a healthy lifestyle are key components of stroke prevention. Section 8. Recognizing stroke with FAST. The acronym FAST helps recognize stroke symptoms. FAST stands for face drooping, arm weakness, speech difficulty, and time to call 911. This simple tool can save lives by prompting quick action. Face drooping is a common sign of stroke. Ask the person to smile. If one side of the face droops, it could be a stroke. Early recognition is crucial for effective treatment. Arm weakness is another sign. Ask the person to raise both arms. If one arm drifts downward, it may indicate a stroke. Quick response can reduce brain damage and improve recovery. Speech difficulty is also a key symptom. Ask the person to repeat a simple sentence. Slurred or strange speech can be a sign of stroke. Calling 911 immediately can make a significant difference in the outcome. Section 9. Additional symptoms of stroke. Besides FAST symptoms, other signs of stroke exist. Sudden numbness or weakness in the face, arm, or leg, especially on one side, is common. This can happen without warning and requires immediate attention. Confusion and trouble understanding speech are also signs. A person may suddenly have difficulty speaking or comprehending simple sentences. This can be frightening and needs quick medical intervention. Vision problems are another symptom. Sudden trouble seeing in one or both eyes can occur. This may include blurry vision, blackened vision, or double vision. Prompt action is needed to prevent further damage. Difficulty walking, dizziness, or loss of balance are also indicators. A person may suddenly feel unsteady or unable to coordinate movements. Immediate medical help is essential to mitigate these symptoms. Section 10. The importance of quick action. Time is critical when it comes to stroke. The faster you get treatment, the better the chances of recovery. Every minute counts. Quick action can prevent long-term disability and increase the likelihood of survival. If you suspect someone is having a stroke, call 911 immediately. Do not wait to see if symptoms go away. Immediate medical intervention is crucial. Paramedics can begin treatment on the way to the hospital. Hospitals have treatments that can dissolve clots and restore blood flow to the brain. These treatments are most effective when given within the first few hours. The sooner they are administered, the better the outcome. Educating yourself and others about stroke symptoms can save lives. Knowing what to look for and acting quickly is essential. Awareness and preparation are key to improving stroke outcomes. Section 11. Prevention tips and conclusion. Preventing a stroke involves managing risk factors. Regular checkups can help monitor blood pressure, cholesterol, and blood sugar levels. Medication and lifestyle changes can effectively control these conditions. Adopting a healthy lifestyle is crucial. A balanced diet, rich in fruits, vegetables, and whole grains, can lower stroke risk. Regular physical activity helps maintain a healthy weight and reduces other risk factors. Avoiding smoking and limiting alcohol intake are also important. These habits can significantly reduce the risk of stroke. Support and resources are available for those who need help quitting smoking or reducing alcohol consumption. In conclusion, understanding the causes and early signs of stroke is vital. Quick action can save lives and improve recovery. By managing risk factors,